China's National Health Commission made a concerning revelation over this past weekend about a surge in respiratory diseases that the country has seen in recent weeks. It cited a blend of common viruses and already established bacteria as the main culprits behind the recent outbreak. The mix includes well-known pathogens like the influenza virus, rhinoviruses, respiratory syncytial virus, the RSV, adenoviruses, and the bacterial strain mycoplasma pneumoniae. This disclosure follows the World Health Organization warning last week that there was a steady increase in respiratory illnesses in China. They had a press conference on the 13th of November in which the WHO flagged its concern. The Chinese authorities, however, have denied the presence of any new pathogens, any novel pathogens, in response to the WHO's inquiries. However, data provided by the Chinese authorities indicates a notable uptick in hospital admissions, and particularly for children who are affected by either bacterial infections or RSV, influenza, and even common cold viruses since the beginning of October. Now, seeking further clarity, the WHO has requested additional information attributing the surge to a relaxation of COVID-19 restrictions. They are also attributing the surge to the advent of the winter season, the diminished immunity in children, which has resulted from prolonged lockdowns. This is the first post-COVID winter that children in China have been exposed to without any COVID restrictions whatsoever. But experts have also underscored the connection between the rise in infections and China's initial experience of a full-fledged cold season following the easing of COVID restrictions. The suggestion is that children who have spent a substantial portion of their time in lockdown without exposure to other kids, without exposure to a school environment, they simply lack the immunity that is required to combat what are common and natural pathogens. Reports have also surfaced about hospitals being overwhelmed with surging crowds. It includes not just the affected children, but also their concerned parents, and much of this is happening in northern China, including the capital city, Beijing. But just in the last few days, we have had reports of this spreading to southern cities like Shanghai. Shanghai schools, for example, have issued a warning this past week asking students to exercise utmost caution when coming to school and when mingling in mixed settings. Health authorities in China have advised the public to seek care for children who have milder symptoms at clinics and other facilities and not to go and burden regular hospitals which are already stretched thin. The outbreak, the latest one in China, could be linked to a surge in what is called mycoplasma pneumoniae. It's a pathogen that causes respiratory illnesses among children, the symptoms of which include sore throat, fatigue, and a slowly worsening cough that can sometimes last for weeks or even months. A surge in infections that is caused by this pathogen, also known as walking pneumonia, is thought to have been caused by a lack of collective immunity that China has seen because of the strict lockdown measures that have been imposed in the last few years. Despite the echoes of a potential pandemic, a new pandemic, some experts like Paul Hunter from the University of East Anglia have dismissed the possibility of any new pathogens being discovered. He has instead highlighted the limited number of infections in adults, suggesting that pre-existing immunity from previous exposures is the reason why only one section of the population has been targeted, and that is children. According to this analysis, if this were to be a new outbreak, then there is no reason why it should affect just one segment of the population and not members of the general population. The situation also raises questions about the efficacy of extended COVID lockdowns, with concerns particularly that children in China might not have developed natural immunity against these viruses. But that does not fully explain how similar surges were not seen in children in other countries, in the US, in the UK, in other parts of Asia, post-lifting of COVID restrictions. The emergence of new flu strains or viruses that are capable of triggering pandemics typically starts with undiagnosed clusters of respiratory illnesses. Whether it was the severe acute respiratory syndrome or SARS, or even more recently COVID-19, these began as unusual cases of pneumonia. The pathogens that caused those diseases were not known before. The WHO has stressed the need for more comprehensive information to properly assess the risk associated with these respiratory illnesses in Chinese children. Now, these developments also revive earlier accusations of a lack of transparency on the part of Chinese authorities, as well as the over-reliance of the WHO when the COVID pandemic initially started in December of 2019. The pandemic, which originated in the central Chinese city of Wuhan in December 2019, prompted global scrutiny into the handling of information and data sharing. There were concerns about delays and outright obfuscation by the Chinese authorities, and the WHO also received criticism that it was not critical of the Chinese lack of response in the initial days. The initial outbreak of COVID-19 in Wuhan, China, also raised numerous questions about transparency and accountability. Allegations have circulated ever since that China engaged in a cover-up, particularly in the early stages of the pandemic. The Wuhan Institute of Virology, where the virus is believed to have originated, came under scrutiny for its lack of transparency. Questions also arose about the safety protocols in place at that institute and whether or not the institute had adequately disclosed information about the research it was conducting on coronaviruses. Some theories even suggested the possibility of a laboratory leak. Even though it's been 3 years since COVID happened, there has not been yet any conclusive evidence supporting the lab leak theory. The World Health Organization, like I said earlier, also faced criticism for its handling of the early stages of the pandemic. Initially, the WHO even praised China for its transparency, but as more and more information emerged, it became evident that there were gaps, wide gaps in the data that was being provided by the Chinese authorities. The WHO was accused of being caught unawares and also being overly reliant on China's reporting. And that led to some very crucial delays in understanding the severity and the nature of this virus, and perhaps even an attempt to try and contain the virus within a certain geography, in this case China. So, the question again comes back to the current round of respiratory illness, whether or not enough information is being shared by the Chinese authorities, whether or not the WHO is in a position to know entirely and understand entirely the severity of this latest round of illness and the nature of the virus that's causing it, and if at all it is possible at all to try and contain this within a limited geography, or whether it will spread to wider parts of Asia and the rest of the world, much like COVID-19 did. So whether or not the WHO and other international health organizations have learnt their lessons from 3 years ago will be known in the course of the next few weeks.